So I had some of you guys not too long ago when we did a mobility seminar just talking about very basic conditions that common causes as far as mobility and different things that people are struggling with. But today we're focusing on the low back. And for you guys that don't know me, my name is Izzy, and I am a second-year student as a physical therapist. And I actually just spent a really good amount of time studying the low back, the hip, the knee, all of the lower extremities. So I'm excited to be here with you guys. I know that there were some questions that we definitely are going to address that we specifically, Christy sent us at the end of the seminar. And today is going to be about really learning a little bit more about the anatomy of your spine, especially your lower back, how that relates to your pelvis specifically. And then I know that both Eduardo and Christy talk about the importance of alignment and core strength, but we're also going to be doing that as well. So our goal is to give you more awareness. Our goal is to teach you some new things that you can kind of incorporate in your life to help you manage low back pain if you struggle with that. And I'm going to go ahead and let Jacob go ahead and start and introduce himself. And we'll stand up and just kind of go ahead and talk to you guys a little bit more. And Jacob is going to go ahead and introduce to us something new. And he's going to kind of have us be a little interactive to start. So everybody's just going to go ahead and stand up on their mat, and I'm going to go ahead and let Jacob take it away.
All right, so if you have room, we'll have everyone stand up. And this is kind of a little bit of a test. If you don't feel comfortable doing it, feel free to use your hands. But what we're going to do is see if we can sit down on the floor without using our hands and then stand back up. Christy did mention that she has been working with this movement for some of y'all. So we're just going to go. We're going to go Indian style, and we're going to sit down.
Use your hands as you need to, guys.
Good.
Just very carefully.
I was making you guys practice this before.
And then after we're sitting down, we're going to try to stand back up without using the hands.
So do what you guys need to do. Rock, you can use your arms.
Good. All right, so my name is Jacob, and we want to thank Christy and Ed for allowing us to be part of Yoga Lemonade. This is Izzy and I's first online seminar, so we're really excited. The test that we just did is kind of a precursor into the things that we're going to get into. A little bit about me. I'm a family nurse practitioner. I practice family medicine. Prior to family medicine, I was in the ER for 3 years. I often recommend yoga to most of my patients. I think it's wonderful. I think it's great for longevity. So in high school and college, I played college football. I'm an avid golfer now, but I missed my fitness level and my activity. I suffer from low back pain. Started in early years with improper alignment with squats, heavy weights. And then as I went into the hospital, working with patients, bending over, lifting patients to the bed, starting IVs, not having a strong core, often being in this position, it led to a lot of low back pain and radiculopathy. So I was sitting at my house and I was scrolling through Facebook, and this sit to stand test came on. And I was like, I'm healthy, I can do this. So I went to sit down on the floor, and I couldn't sit Indian style. I had a really difficult time able to get my pelvis over my center of gravity in order to stand up. And the significance of it is that with more mobility and functional strength, if we're able to get up off the floor, able to stand up, there's more, it's according to more longevity in life. We know that if we have these types of movements, if we're able to balance ourselves better, decrease our risk for falls, decrease our risk for hip fractures and so forth. So Izzy and I both have a passion into wanting to help others. And so that's why we're here today, to teach y'all a little bit about pelvic control, okay, and core stabilization. Because able to control your pelvis and core stabilization is really important. It's your center, it's your powerhouse in a lot of these movements. So one of the most common complaints that I get in the ER, there was a systematic review done over 12 countries, and the 4th ranking complaint was low back pain. So if you have inefficient pelvic control and core instability, it can lead to numerous lower body problems such as low back pain or radiculopathy. We know that the body works best as a whole, mind, spirit, and strength, okay? Even on the molecular level of pH balance, we're always trying to find a balance and homeostasis. If we have regions of our body that aren't working optimally, they will start pulling on other parts in an inefficient manner, and that can lead us risk for low back pain and other problems. So what we're going to do is start off, feel free to stand or sit, whatever comfortable. We're going to do a little bit of anatomy. So what is the pelvis girdle? We have our spine right here, cervical spine, thoracic spine. This is the lumbar spine, and then this is the pelvis. You can see front view and a back view of the pelvis. Now the pelvis is composed of two large bones, left hip bone and the right hip bone. It's attached to the front by the pubic symphysis right here. And if we turn it around, it's attached in the back by the sacrum, and we all know the coccyx right here. So the positions that we're going to talk about today, there's going to be three positions. It's going to be anterior, where the pelvis is tilted forward. So it's going to be this view, okay? Posterior, where the pelvis is tilted back. And then we're going to try to find a neutral position, because the neutral position is where we want to be in most of our activities in life. So now that everybody's sitting down, we'll have everybody stand up again. Okay, now, if you don't know what a horse bit is, that's okay, because I've only ridden horses 3 times in my life. But a horse bit is a piece of metal that goes into the horse's mouth that enables to control the horse's head. So we're going to start off in a bad posture, so slump down, kind of make you feel. So when I get in this posture, I already feel kind of icky and sad. So I want you to imagine there's a horse bit hanging above your head, and I want everybody to reach up tall and try to bite it. Nice and tall, and then gaze down with a big smile on their face. So gaze down and look at me with a big smile. That is a good lengthening posture. So we go from here, picture the horse bit, bite it, and gaze down. And that already puts me in a better mood. So I'll go from here, slumping, to posture. That makes my cervical spine, my thoracic spine, and my lumbar spine all in a good alignment. All right, so now let's talk about an anterior pelvis tilt. Now, if you have any questions during this, raise the hand or ask, and then we can go for it. So now I want everybody to have spirit fingers, okay? And then I want you to place your fingers onto your belly button. Perfect. And y'all can face me. I'm going to go sideways. And so the anterior pelvis tilt, we're going to feel the belly button go down to the floor. So it's going to point down to the floor, and the butt, the rear end, is going to go back. So you're going to get in this position. So you're going to go from neutral, your horse bit, to anterior. It's a slight movement from neutral to anterior. Would you like to show them?
Yes.
And this we're just doing slow motions. Fingers on the belly button, neutral position, and then anterior. Neutral and anterior. Now, the reason why we're finding these extremes is, as you can see here, the lumbar spine in the anterior view, what it does is it compresses these vertebrae, okay? We like these vertebrae to be nice and have good spacing. Now, your normal spine will have some normal curvature, an anterior curvature, but a lot of times we see patients and people walk around or sit for long periods of time, and they're sitting like this. And what it does, it extends these vertebrae, which then presses on these jelly-like discs. And if these discs, if we can bring it out, these discs have a gel-like substance and they can protrude. And if they protrude, then they can press on these nerve roots, and the nerve roots radiate down the lower legs and go throughout the body, which can lead to low back pain. So, neutral position, perfect. And then anterior, and this is just a small movement, neutral and anterior. Good. Now, the second position that we're going to talk about is called the posterior pelvis tilt. Now, this one is very useful in some things, and we'll get to that. Now, the posterior position, we're going to go back to our horse bit, nice alignment. spirit fingers on the belly button. And then now we're going to feel our gluteus maximus, okay, our gluteus minimus. We're going to feel our deep pelvic floor muscles. So we're going to tighten up the butt, and then we're going to feel the belly button go in as it goes to the sky. So that's going to put you from neutral to posterior, neutral to posterior. Good. And you should, when you go to neutral to posterior, you should feel the glutes activate. They talk about glute activation in a lot of things, a lot of sports, in yoga, activating the core. Well, this is all part of the core, the gluteus maximus, the gluteus medius, the deep pelvic muscles. And sometimes we don't know how to control those muscles because those muscles they're inverted by nerves. But if we don't know how to use it, then we don't know how to control it. So our goal is for you to find these small movements from neutral to posterior. So when Christy or Ed say, hey, we want you to engage the core, this is what we're talking about. We're talking about tightening up the glutes, and then pelvic floor muscles, the belly button's gonna be pulled towards the spine as it goes up to the sky. And that gives you a good, strong core. This will help you a lot in your holds. In CrossFit, when we would do hollow body holds, or in yoga, if you're doing holds, you don't want to be in an interior rocking on the ground like this. You want to engage to get this alignment and flat back and keep everything in line. So anterior position is where the belly button's down. Posterior position, the belly button's up. And how many of us, I work in the office, and how many of us sit like this, okay, with our computer handling? I often find myself sitting at the desk like this. And so what that does is it shortens your hip flexors, your psoas muscles. And if you're sitting 6 to 7, 8 hours a day, you're sitting like this in this posterior view, all these muscles are shortened. And then we go up to do exercise, we expect these muscles to elongate, and then it causes stress. Just as the body works as a whole, if these muscles are shortened, all right, it's going to find a way to compensate, so it uses the back, and then that's when you go over to pick up the laundry basket, and then you get a back strain. And so able to learn how to control your pelvis, in most cases, we want to be in a nice, neutral, slight engagement of the butt and slight engagement of the pelvic muscles, the deep pelvic one, and that keeps you a good, strong core.
Awesome. Yeah, so Jake did a really good job of introducing what we have. I had you guys do this when you were with me earlier. And what I'm going to have Jacob do is he's actually going to go ahead and lie on the ground with his back on the ground, his feet bent, and his feet on the floor. So I'm going to have everyone go ahead and find this position for me. And once you're there, just kind of like, just listen. You don't have to necessarily be looking at me. And what we're going to practice is something called diaphragmatic breathing. Okay, so just very quickly, I'm not going to get too much in the weeds about this, but if you want to see me to understand like a little bit of the anatomy I'm talking about, great. But if you just want to listen, that's great too. So we have our rib cage, right? And all of our ribs end about here. And then your diaphragm is a big muscle that sits right underneath it, okay? And that muscle is responsible for us to breathe. But what happens, I'm going to have Jacob do an example, is a lot of us breathe through our chest, right? So if Jacob just elevates, his chest expands and relaxes, okay? And what happens is this is inefficient because these muscles aren't made to do most of the work for your breathing, okay? It's this muscle in here. But what has to happen is we have to learn how to engage those deep pelvic muscles, which exist kind of deep down in here. They're hard to engage, our core muscles, and this muscle to find that. So what I'm going to have Jacob do, and everyone's going to do this with him, you're going to put a hand on your chest, and you're going to put a hand right below your belly button, okay? Now, kind of what Jacob was talking about, that posterior tilt position is really helpful for us on the ground because it helps to make sure that we protect our back. If we have a curve, if we have that anterior tilt Jacob was talking about where our belly button drops and we have this space, if you can see me with Jacob, I have my hand can come underneath here. So now his low back is at risk for compensating for what the core is supposed to do, okay? So what I want everyone to feel before we even start breathing is almost what Jacob was talking about, a slight engagement of your glutes, squeeze your glutes and almost try to draw that belly button in. And if I were to try to slide a piece of paper between your low back and the floor, I shouldn't be able to do that. Okay, this is kind of a pretty strong engagement of our core here. Now, with a hand on your chest and a hand on your belly, you can watch Jacob. All I want you to do is the only movement you should feel is in that lower hand the whole time we do this, okay? So as you inhale, I want you to imagine almost as if you're putting pressure kind of into where your pelvis is. So when you breathe in, it's almost like if you were to take a big sniff, okay? You should feel it down there, and you can practice it if you need help here. As he inhales, his lower hand is rising, and as his exhale, his lower hand is dropping. Okay, and I'm gonna try to watch those of you I can see from the side. It's okay if I can't see you, don't worry. But what you should feel here is you should feel no movement in your upper hand, okay? And while I would love to be here to actually be able to feel this on you guys in person, I want you guys to kind of just bring awareness to that bottom hand that you have on below your belly button. As you inhale, I want you to try to rise that lower hand as much as you can for 3 to 5 seconds, like you're filling your lower tummy with a balloon. And as you exhale, I want you to go ahead and let it drop, only moving below your belly button. I want you to close your eyes, and we're going to be here for about 1 minute. So if you find yourself thinking about what you're doing after this or what you have to do today, I want you to just kind of bring your attention back to your breathing. You have a belly button underneath you have a balloon underneath your belly button. As we inhale, we take 3 to 5 seconds to really blow our balloon up. And as we exhale, we allow that bottom hand to drop. When you find that upper hand starting to rise, go ahead and bring back attention to the lower part of your belly. So as we inhale, we feel those muscles rise. And as we exhale, we feel those muscles drop. I want everyone to go ahead and take 3 more breaths here. So go ahead and inhale. See if you can make it longer this time. Inhale for 5, 4, 3, 2, 1. And exhale, 5, 4, 3, 2, 1. Let's do it together 2 more times. Inhale for 5, 4, 3, 2, and 1. Exhale, 5, 4, 3, 2, and 1. Inhale again, 5, 4, 3, 2, 1. Exhale, 5, 4, 3, 2, and 1. Everyone go ahead and relax. I would like for can everyone give me an idea of how that felt? Did we like it? Was it challenging? A little bit of feedback on that from you guys.
Lovely.
Feels like
That was good. Okay, so guys, this is exercise number 1 for low back pain. And why? I'm going to tell you why very quickly. Is because a lot of the issues, a lot of the common causes, right? I can tell you just based on what's common. Jacob can tell you based off of what he sees. Injury in general, oftentimes, not always, happens because of lack of stability and lack of mobility. They are 2 very different things. Stability involves kind of what Jacob was talking about, right? We have these nerves from our brain that actually control our muscles. And so you can do movements all day long, but if you don't actually know how to activate those muscles, it's not going to matter. So like that's when Jacob was talking about, if I go to pick up something, I can pick up something from the floor like this, or I could pick up something from the floor like this, right? And that involves having awareness and understanding these positions. So most of the time, a lot of injury can be prevented by understanding how to stabilize, okay? And so this is what we're trying to learn. This is why this kind of breathing is so important, because your body will breathe. It has to, right? But the quality of the breathing is what's important. So practicing this is very helpful so that you can get the right muscles of your core, your pelvis, as well as the diaphragm engaged. So that's exercise number 1 for you guys, okay? Next thing I'm going to teach you, and Jacob's going to be here, and I'm just kind of going to sit next to him. He's going to be my little mannequin for today. The next thing we're going to work on is something called a hollow body hold. So I know Christy and Ed love core, and they talk about it all day long because it's so important. Because if this is not strong, then none of this is strong, right? And so if this isn't able to undo its job, then that's when all these compensations and injury things start to happen. So what's going to happen is you can watch me first just so that you know what we're going for here. There's going to be different options of this and different levels for everyone. So what Jacob's going to do is he's going to find that posterior pelvic tilt like what we talked about. So this is anterior, right? You can see I can fit my hand in here. So this isn't turned on at all. So what's going to happen is if you try to do this, a stretch, a lot of us do core exercises like this. And then we have low back pain the next day because our abdomen and our abdominal muscles aren't engaged, our core muscles, okay? So what he's going to do is now he's going to go ahead and find the posterior tilt. And now my hand is like screaming because there's no space there, okay? This is what we're going for, but we're going to show you the modification. So Jacob's going to bend his knees. We're going to sequence this together. So I'm going to show you and then we can do it together, okay? So that you can know what we're doing. So first, posterior tilt with his feet on the ground. So he's going to squeeze his glutes, draw his belly button in. After that, he's going to bend his knees right over his hips and raise his feet. From here, what we're going to do to help you find it is reach his arms towards his heels. And the goal is to be able to hold this. Okay, this will be level 1, and you're welcome to stay here. Level 2 will be maintaining that posterior tilt. He's going to go ahead and extend one leg first. Then he'll extend another leg. And then our advanced option eventually will be arms overhead. Perfect. So let's go ahead and sequence this together. Wonderful abdominal exercise for stabilization. Jacob's already feeling that. It was 10 seconds and he was already feeling it. Guys, I want you to think about, it is not about what option you do. It is about the quality of the option you do. If I see a tuck hold with a beautiful engagement, I'd much rather see that than your arms over your head with an anterior tilt, kind of like what Jacob's demonstrating, okay? So we're gonna all sequence together. Everybody, feet on the ground, arms relaxed. I want everyone to bring attention to your belly button. You can even put your spirit fingers that Jacob talked about near your belly button to help feel this, okay? Now everybody go ahead, find the posterior tilt, let your belly button draw in, slightly engage your glutes. Go ahead and squeeze your glutes. From here, you can lift one knee at a time to 90 degrees, and then another knee. Everybody hold. Do not move from here. If this is enough, and this is hard, I want you to hold it. We're going to see how long we can hold this position. Jacob's going to tuck his chin in. The next option, go ahead and reach for his heels. Before you try to go any farther with this option, try to glance over here. I'm going to have Jacob keep his knees bent, but slightly push his feet away from him and hold it. So he goes from 90 degrees. He keeps his knees bent and he slightly pushes his feet away. That's going to challenge you holding your posterior tilt and the engagement of your core. Everybody hold it. Keep it there. Watch me. Feet stay bent. He's going to push his feet towards the wall a little bit more, but keeping them bent and hold. 5 seconds. Stay here. If you can come with me, rest when you need. Go ahead, push them out a little bit farther to where they're straight if you can, or just hold your bent knee position. 10, 9. Everybody get back up. You can do it. I see you. Good. 8, 7, 6, 5, hold it, 4, 3, 2, and rest. Can you show me a happy hand if you felt that? Happy hands. Okay. So I'm going to tell you that I am guilty of this, but sometimes I see all the really cool, exercises where we're lifting our legs, we're doing all these fun stuff with our core. Guys, the first goal should be able to hold that for 30 seconds. Like very strong without deviation of position. Why? No compromise. Meaning like if you have 10 seconds and you start to feel your back kind of pop out like this, which is what will happen to try to keep you up, you stop. And your goal would be able to hold that position, whatever modification, for 30 seconds. That's your challenge number 1, okay? If we can't hold our spine in a position, it's kind of crazy when you really think about it, that we ask it to do all these things. Right? And in yoga, I'm still a very new beginner when it comes to yoga, but especially a lot of those positions that we want to achieve, our balance goals, our positional goals, a lot of those really great positions to open up our bodies. If we don't have the stability, it's kind of crazy sometimes that we ask our body to do a lot of things, right? And it's kind of crazy where you can imagine if you struggle to hold that for 30 seconds, which, I mean, I've been working on it as well, and so is Jacob. But if you struggle to hold that for 30 seconds, imagine what happens when you try to pick up something off the ground that's like 20 pounds, right? And so the whole goal here is that you understand the importance of learning that stability. So if you felt that in your low back, you should not. So what I would recommend to you, if that is the case, is stay here with your feet on the ground and actually just reach up towards your heels and be here. That would be your option if you felt that in your low back, because what that means is that our core muscles aren't strong enough yet to handle the load of rising off the ground. Does anybody have any questions so far?
What
Yes,
if
ma'am. Go ahead.
what if your neck, like for me to lift like my neck starts to feel like I can't hold it?
Yeah, so a couple different options for you would either be, especially if we have neck pain and tightness, I would recommend putting a towel here and not lifting your neck off the ground. Okay. So if you have any neck pain, that is a common thing. A lot of people talk to me about when they do sit-ups and stuff, they feel neck pain. A lot of that has to do with, most of the time, it's very difficult when we do core exercises to keep our chin tucked. And we'll save this for another seminar. Jacob and I's next one is going to be neck pain for you guys, but because that's also very common. But what happens is when we're trying so hard to make the core muscles, this happens. So I don't know if you can, it might be difficult to see me, but I pretty much, my head goes back, my eyes go up, and I'm extending my neck here. So kind of what we talked about with the anterior tilt, right? That brings those vertebrae closer together and it causes pain because there's not space in between them to help cushion them. So if you were experiencing neck pain with that, I'm gonna go ahead and show you. I'll have Jacob stay where he is. And I'd go ahead and have him lie down. I'd have him put his neck on a pillow, which should feel kind of nice. I'd have him bring his knees up to 90 degrees and then have his core engaged. And I wouldn't ask you, I just would ask you to reach with your hands without lifting your neck off the ground.
Okay.
And that'll help take the pressure off. That should feel pretty good on your neck. Does that feel good?
Yes, it feels good.
Okay.
A lot of times the anterior muscles in the neck itself aren't trained to have the strength just as the deep core muscles are. And when we get in these strong positions for our core. So we'll go over some exercises that will help train these anterior muscles. A lot of times when we sit, we're sitting like this. And so these muscles on the anterior aspect of the neck, as we ask them to engage, to hold up, those muscles are weak, just as if our core muscles are weak and we have a hard time extending out and we go into the anterior pelvis tilt. So there's some exercises that you can do to help train the anterior muscles and engage those and strengthen those muscles, just as we're trying to train the pelvic muscles, the deep core muscles to control the pelvis. It all goes together. The body works as a whole. So once you're working on one exercise and you find that you're having pain in other areas, that's probably likely due to the lack of the strength in those certain muscles. And so if you're feeling the pain in the front of the neck, it's likely due to your anterior muscles, these sternocleidomastoid muscles that go here in the front. And if you're feeling the pain in the back of the neck, excuse me, just as if the lumbar spine, these vertebrae will start to compress as well. And you have muscles that go to the back of the skull, the suboccipital muscles that often engage. Your chronic headaches, people who have neck pain, these can lead and it can actually radiate to the side of the head. We call them cervicogenic headaches. And so able to have good strengthening of the neck muscle plays an important role in all this as well.
Yeah, so our goal, we definitely will go over that more. I would bring your attention to either having a place, a pad for your neck, or going ahead and really trying to focus on keeping the position that allows you to keep your chin tucked. And when you find that chin tuck starting to lose, perfect, just like this. And when you feel that chin tuck starting to relax, that's where you would stop your option, okay? Or you'd stop the time. Very good. Does anybody else have any more questions? We're good?
That's great. Thank you.
We're good?
Yeah, thank you.
Okay, you guys speak up if you have any questions. Sometimes it might be hard to hear you guys, or we can also, if you raise your hand on Zoom, we can kind of make sure we're answering those as we go through. So that's exercise number one. Your goal is to really work on those hollow body holds, those positions. We call them hollow body holds. Probably the name, I think, comes from really creating almost that banana shape that allows that good core engagement. So I'll make sure that Christy and Ed throughout their classes that they're keeping you guys accountable to that exercise. Okay, the next thing that we're gonna do is actually this should feel very amazing on your low back if you have low back pain. So get excited about this one. I'm gonna have Jacob on all fours in front of you. Okay, so before we get started, I want to teach everyone what this is called. So when you guys are in yoga, I want you to look at my hands. Okay, I have one on the upper part of Jacob's back and I have one on the lower part. He's going to show you what we mostly do when we say the word cat-cow. Okay, so watch what happens to my upper hand in relation to my lower. So he's going to do a couple cat-cows. Do you see how only my upper hand is rising and falling? Do you guys see that? So this hand isn't moving, right? We mostly move through here, right? But when you guys are talking about low back pain, what I like to kind of call it is your tissues, your muscles, your tendons, your ligaments, they get stuck. Right, that's a good way to put it, right? Like they get stuck, like they just don't want to move. So when you say you have back pain after sitting, after doing activities, those tissues get stuck, they're like glued together, and then you ask them to do all of this range of motion stuff, and then they pull apart and they get strained, okay? So now I want you to watch what happens when I ask Jacob to only move through the lower part of his back, what we call the lumbar spine. So this arm is gonna stay still, and this arm is gonna move. Go ahead and show us, Jacob. So this one will move a little bit, but I want you to look at the difference in the lower hand. Do you see how now my lower hand is moving? Okay, this is really hard to do, really hard, because this will move a little bit, but again, I want to show you again the difference. So just do a normal cat-cow with this arm. Look at my lower hand. Go a couple more reps. This isn't moving at all, and this is where most of us stay, right? So I'm going to challenge you today to go ahead, and now he's going to show you again what it looks like to move through this part of your back, only through his lumbar spine. So they're both going to move, but feel how this hand is now moving as well as my upper hand. Do you guys see that?
Yes.
Okay, that's step number one. So we're going to practice that. If you can, try to show me a view from you from the side. If not, it's okay. I'm going to help you guys stay accountable to finding this yourself. What I really want you to feel, Jake and I will watch you guys, is movement from the low back. So now you can watch me, another person do it.
Yeah, these are the positions that we talked about in the beginning. Anterior, this is posterior, belly button up to the sky. So you're going to feel as the belly button is being drawn into the spine. And then anterior, the belly button's pointing down to the floor. So these are the same positions that we talked about in the intro, but now we're implementing into one of the movements and able to control. This is a good exercise to able to control range of motion of the pelvis. This allows us to find the extremes of the pelvis control. And our goal is, with extremes, we know that we can find a neutral position right here easier. If we don't know what posterior feels like, if we don't know what anterior feels like, then we don't know where neutral is. So our whole goal is to show range of motion and to find a neutral position along with this as well.
Yeah, so I want to see you guys move through 10 reps of that, only focusing on moving through your lower back. And I want you to note maybe how much different this feels than when you do your normal cat-cow pose in yoga. Because a lot of times we only move through that upper part of our back, and I'm challenging you today to move, really focusing, bring all of your attention on the low part of your back. And you're going to move those glutes in as much as you can when you go posterior, and then those glutes are going to go up as much as you can with posterior, and you might have to move through really slow. After you've done 10 reps, go ahead and relax.
It's actually quite hard.
It is. I will tell you that if you truly suffer from low back pain and you are doing this correctly, it will be very challenging, because you are challenging those tissues to expand, to lengthen. Yes. Mm-hmm. Yeah, so we're about to go there. I see you already going there. We're about to go there. So what I'm going to teach you guys now, and you can, again, can ask me questions after. I'm going to go ahead and show kind of like, so you can see a little bit more of Jacob's skin a little bit. Okay, what we call this is a self-mobilization. All that means is that we are trying to take those vertebrae, like what we showed you, and we're trying to create more space, okay, to help loosen the tissues. So what you're going to do, just watch me first. You're going to find that posterior position And now Jacob, as slow as possible, is gonna move back into a child's pose, as slow as possible. And you are going to go only as far as you can until you can hold that position. So like Jacob probably isn't gonna go all the way to his heels, because if he's truly staying in that posterior tilt, this is all he can go. And if you ask Jacob, he will tell you how much he feels this.
A lot.
A lot, okay? Because this allows you to get to a deeper level of tissues than just your muscles. So what I want everyone to do is go ahead and be on all fours. I'll go ahead and watch. Jacob gets lots of practice with this today. He's gonna go ahead and find that posterior tilt. And now as slow as possible, he's gonna hold that posterior tilt, holding it as much as he can, keeping that belly button drawing in and pushing his glutes, his bottom back to his heels. And I want you to hold that until you feel yourself lose the position. And I should see a good rounding of the lower part of your back here. If you really suffer from a lot of low back pain, you will not be able to go all the way down. And then very slowly come back up. I want you to do 5 repetitions. So go ahead, really find that posterior tilt. Watch Jacob, he's gonna push back, push back, push back. Good. You need 5 full repetitions here, guys. Keep going for me. And Linda, I really want you to think about, I kind of see you down there. Linda, I really want you to show me more of this motion. So come back to quadruped, and everybody keep moving through 5 reps, but Linda, I'm gonna go ahead and have you give me more. So he's gonna posteriorly tilt, really feel your entire back round. So show me that. So you're gonna go the opposite direction. So bring that belly button in, squeeze your glutes, and come here to where your back is rounded. Perfect. Now you're gonna hold that and slowly push back. Beautiful, very nice, very nice. I want everyone to do 5 full repetitions of that movement.
Well, that's tough.
Go ahead and keep moving, guys. I want these as slow quality reps as possible.
Wow.
Wow.
All right, guys. Questions, comments? I would love to hear your feedback, what you thought, what you felt.
It's hard work moving slowly.
Yeah.
Yes, that's what I want to hear. That like puts the biggest smile on my face. It should be tough work. This is an example of when Jacob was talking about, again, I'm going to bring it back to this, the whole part of your nerves kind of signaling your muscles what to do. Like you do child's pose all the time, right? If you go to yoga class, you always do child's pose. Have you ever done child's pose like that? Probably not, right?
No.
So it's a whole different awareness of your body. And this stuff is so hard. Like, I'm so thankful that you guys are here. Jacob and I love this stuff. We can like nerd out about it, but this stuff is so important because this is the stuff that this isn't the cool stuff, right? Like, it's not cool to sit there maybe and be like, all right, let's do a whole class where we put you in that position and we have you feel that in your low back, right? It's a very simple thing, but it makes a huge difference. So in addition to that hollow body hold, I challenge you with that exercise. You feel low back tightness, you're at work, you have a place where you can do that. Jacob will tell you it feels really good for him. And he really enjoys that. The last thing I'm gonna have Jacob demonstrate, this is your last exercise, and then Jacob and I both will kind of answer any more questions. He's gonna have his legs out in front. Okay, so you have this position normally. This is again gonna challenge a little bit of awareness. So this is bad posture, right? We're all gonna bring it back. So while you're in this position, go ahead and bite the horse bit. Kind of bite on the top, bring your head down, and reset your posture. Beautiful. Yeah.
Oh, nice.
Hey, Jake, when Jacob first told me about that, I used it in a situation where I was really stressful, and it made a big difference. So regardless of even like just what we talk about here, the idea of kind of walking through a door, biting the horse bit, resetting your posture, also just changes your level of confidence.
If anybody sees you doing it though, you didn't hear it from us.
Yeah. If anyone sees you biting the air and then resetting it, just don't say our names, okay? But that's just for you to kind of keep in your back pocket. So what Jacob's gonna do is he's gonna have his arms out in front. And I want you to watch. He is gonna allow himself to almost do what we're gonna call a little crunch by moving one little vertebrae at a time. So you're gonna watch him, he's gonna slightly round forward through his low back first, then he's gonna go thoracic, and then he's gonna go chin to reach as far as he can. If you do this right, then you can go to your stretch at the very bottom, okay? So then I'll let you stretch. After that, one vertebrae at a time, starting through here, he's gonna rise. So he's gonna pull the bottom segment up first. Then he's gonna try to pull back from his mid-back, try to pull back from his upper back, come here closer towards his neck, and then he's slowly going to reset. You're welcome. Doesn't that sound fun? Okay, so arms out in front. All right, so Jacob's gonna go with us. I'm giving Jacob a workout today. He needs to loosen up. Okay. So we're gonna go ahead and go one little segment at a time. So he's gonna round forward. So the first segment to move forward will be shoulders. Then you allow your mid back to move forward, round it. Then you allow your low back to move forward until you get to the very bottom of the stretch. Let your head go down, relax. Now, starting with your low back, I want you to imagine as if you're pulling your low back behind you. Then you're going mid back. Try to separate it. Then you're going upper back. Then you're going neck. And then you're going all the way with your head. Let's only do, yeah, Jacob's gonna kind of add something for you guys to think about.
When you're bent over in this position, engage the belly button to activate the low back as we worked on. So when you start with the low back vertebrae, you're going to feel the same movement as the belly button is going to be pulled in to the tummy. That will really engage your pelvic floor muscles. It's just something that I kind of feel as I'm trying to engage the lower back on coming up. I really feel my belly button is as almost if it's being sucked into my spine, and you can really feel those pelvic muscles starting to tighten up, and it gives you more control of that lumbar spine.
Yeah, so he made a really good point, because this is exactly like what we just did in the other exercise. When he draws his belly button in and he pulls his low back away, he's creating space again between those vertebrae. So we're helping to loosen up some of those tissues. So I want to see everyone just go through 3 of these, just 3, nice and slow. This is a little bit more of a challenging exercise, a little bit more advanced version kind of what we just did. We're kind of using muscles now besides just stretching. So kind of draw that belly button in like what Jacob was talking about as you rise, then starting with your mid back, then your upper back, and then your head. And I'm going to have all of us go through one more. So go ahead and round forward, one segment at a time, upper, mid, low, and then slowly come up, low, mid, and upper. Yay. How do you guys feel?
Stretched.
If you go slow, your back muscles get sore.
That's what?
When you go slow like that, your back muscles can get sore because you're holding.
Yes. Yes. That is very true.
Can you talk about shoulders as well? Because I feel my shoulders are going up to my ears, and I don't know. I figure they should not be.
Yeah, that's a good point.
Did you say you feel your shoulders coming up to your ears like when you go
I'm
forward in that position?
Yeah.
Okay. Yeah. So pretty much what I'm going to tell you is that when Jacob comes down, this is very passive. Okay. So I almost want you to think about you want to keep the separation between your ear and your clavicle as much as possible. Naturally, if you watch Jacob, there's a difference between him actively bringing his shoulders up towards his ears and him letting them relax and just rounding them forward. so to speak, if you can watch Jacob, his shoulders going up, watch my hands up to your ears. That's different than watch his shoulders go forward now. That's what we're getting. So we don't want this, shoulders coming up, okay? We want shoulders coming forward. So what you're gonna imagine doing almost is you're gonna almost imagine these little bones in the back of your body are coming apart. So his shoulders are gonna come forward, but he's gonna create space still between his ear and his shoulder, and then he's gonna go forward.
If the shoulders come up in a passive range of motion, there could be some mobility issues with the shoulders themselves that's not allowing you to actually be more passive. There's some good shoulder exercises. One of my favorite shoulder exercises that I do with my patients that are having some shoulder problems is doing a wall walk, and you can put your fingers on the wall and just walk them up as high as you can. And then when you feel an area where tightness or you feel resistance, you just kind of hold that there and hold it for 30 seconds, and you can walk them up a little bit higher. Okay, that's a good exercise. It's a safe exercise to do and to create more shoulder mobility. And so a lot of times you can get on the door frame as well and put your hands on the door frame and then slightly press forward. That also will help open up the shoulder girdle. So sometimes if we're activating the shoulders and they're coming up, it could be due to a lack of mobility, which is okay. That's why we're here, is to learn about how, what's right, what's wrong, how do I improve, what part of my body is compensating. If I don't know what part of my body is compensating until I have an injury, that's not good. Our whole idea is like, okay, so I have a weak core. I know I could be more prone to low back injury. So let's build up these core muscles so that we can prevent injury. And it could be the same with the shoulder. We're just finding areas that we have lack of range of motion. My shoulders are pretty tight, so I have to often do shoulder stretching exercises after my workouts. But it could be due because of a shoulder mobility problem versus being more active with the shoulders. So this would be something to look further into for sure. Okay, does that kind of help? Yeah.
Do any of you guys have a lacrosse ball?
Nope, not on me.
So you might not have it on you. I just want, if you have a tennis ball, I do want to show you something quick, and this will be the end of kind of what we talk about today. I'm gonna allow Jacob to just spend like 1 or 2 minutes telling you what to do about it. I know you guys don't have it, but I just want you to know that this is a very useful tool if you can get one. So if you have low back pain, you'll see I have 2 that have been taped together. You don't need that. You only need 1. So really think about a tennis ball, say that you were to go get, these are called lacrosse balls. They use them in the sport of lacrosse. I'm kind of like freaked out when I think about how hard these balls are to use them in a sport. But they actually can be very beneficial for helping you to kind of work on loosening up, ungluing these tissues that we're talking about. If you have one, great. If not, I just kind of want you to just kind of watch and listen, because this can be a helpful tool for you. We're just going to spend 1 or 2 minutes talking about it, and then we're going to finish up questions, okay? So Jacob's going to really quickly review that with you guys. So
this can be one of your best friends. As Izzy said, these are just lacrosse balls. You can get them at Academy for $1.50. You can order them off Amazon. And there's a lot of YouTube videos on how to tape these. If you want to spend a little bit more money, you can actually buy them. It's called a peanut. You can buy them already together. Type in Amazon, maybe $10, called a peanut. A tennis ball will work as well. It's just not as hard. A lot of patients that come into our clinic, I highly recommend getting lacrosse balls or getting a tennis ball. Did you get the spine? Yeah. So our spine is protected. So this is the back of the spine. The spine is protected by a series of muscles called the paraspinous muscles. Okay, and then we have these sub-occipital muscles on the back of the head that is able to allow the head to be stable. What this little friend right here does, it works as your own massage therapist. Okay, we all want a massage therapist to come over to our house and to give us massages after a long day. But if we're sitting at the office, or we've had a hard workout, or we're still finding areas in our back that are knotted up, they're called trigger points, or we're having these sub-occipital headaches from bad posturing, this can be your best friend. So these balls are made to where they can go along the paraspinous muscles and use for massage therapy. Okay. My favorite one that I do is, I'm going to demonstrate, is I'll take the ball. So this is the back of the skull, and I'll place the ball in the back of my head here, and I'll lay down on the floor. And I'll just rotate back and forth, side to side. And then if I find a spot, then I'll hold it on that spot, and I'll kind of call it, it's called flossing. And we just kind of floss back and forth. Not only can you do this on your cervical spine, you can do it on the thoracic spine as well. You hold it there. So I'm demonstrating sitting up, but this one actually is meant to be done on the floor. And you can roll this down the paraspinous muscles on the thoracic spine, the lumbar spine, all the way down. And if you find a spot, you can even do the posterior shoulders, chest, whatever. If you find a spot, ultimately you want to find a spot and hold it there for 1 to 2 minutes. 10 to 15 seconds is good, but really to loosen up those trigger points or loosen up those muscle fibers. If you find a spot that's tender, and do it as tolerated. You don't want to go too hard. If you go too hard, it can cause some damage to the nerves and have some paresthesia, which is numbness. So you just want to do a light, gentle press in that area. Just hold it there for 2 minutes. And this, I have one of these at my office. And if I'm seeing patients and I have time to sit down, I'll grab this, put it in my chair, floss back and forth, and it helps me helps decrease the pain throughout the day. So you can get 2 lacrosse balls, take them together, or get a tennis ball.
Yeah, and you can just use one on each side. The reason that we want to make sure that we kind of, even though this is a low back seminar, we brief you guys about the neck is because it is all related, right? So it is important, like if we have problems here, they're going to kind of go down the chain. So that's why this is something we just want to tell you guys about and show you guys. It's super helpful, like what Jacob said, you're not trying to like smash as hard as you can. It's mainly that once you feel some pressure, you're starting to move kind of back and forth.
There's a lot of YouTube videos out there on how to use those. So if you have an area that's bothering you, you can YouTube how to use a lacrosse ball for massage therapy.
Yeah, and we'll brief you guys, can brief you guys more on that when we talk about the neck. Overall, what did you guys think? Did you guys learn some things? Did you guys have fun? Kind of, maybe like a good kind of fun, a different kind of fun? Yes,
How
ma'am.
long would you do that for, the peanut? Just a few minutes?
Yes, ma'am. Good question. So I think to get the full benefit of the peanut, I would recommend if you could hold it for at least 30 seconds minimum, but 2 minutes would be probably maximum. You should, after about 20 to 30 seconds, the muscles should start to release. I think if you just held it there for a few seconds, if you're doing massage therapy and just trying to loosen up, that would be fine. But if you really want to get the full benefits of the peanut or the lacrosse ball, I would hold it there for anywhere from 30 seconds to 2 minutes. 2 minutes would be efficient time, and that would be recommended, a 2 minute hold. So a minute and a half, but 2 minutes. So think 30 seconds to 2 minutes. If you go longer, I wouldn't go any longer than 2 minutes on that.
Perfect.
Thank you.
Yes, ma'am.
Now, yes, Christy.
So 2 questions. One is, would you guys recommend any different types of props for seating, not in yoga, but just in your car, in your office chair, to improve that back pain or correct your posture?
I'm gonna let, yeah.
Right? Like even shoes can, make a difference. So any ideas about that?
Yeah, I'm gonna let Jacob actually really briefly talk about that because he has done a lot of that. So he can kind of tell you guys a little bit about
So
that.
we'll just start off with the feet and shoe. We'll just talk about good shoe support. There's all different types of shoe out there depending on what you want to use, but you want to have good arch support. That will develop into what we call plantar fasciitis if you don't have good foot support. So I'm going to show you and don't judge me on my shoe, but I'm going to show you what a good shoe for all-day support. If you take the shoe and you bend it at the toe, it should just bend right here, okay? If you're able to grab your shoe and it bends like this, that does not have good arch support, all right? So your everyday walking on your shoes, Asics makes a really good brand. And so if you grab the toe and it bends, you have good arch support. If you're grabbing the shoe and it goes all the way to the heel, it's not a good shoe. I use this shoe for running. I probably should get some different ones, but I don't wear these shoes in the clinic. In the clinic, I wear a shoe that bends at the toe, just like this, give good arch support to help decrease the plantar fasciitis. Chairs. That's a really good question. Because when I'm sitting at my desk or if I'm sitting at long hours, I would tend to have bad posture sitting like this, where I'm in a posterior tilt. So I actually done some research on some ergonomical trick chairs. And the one that I have found to be the most beneficial is the one where you're actually sitting and kneeling into the chair, where it has the pads right here, and it kind of keeps you up in a good posture. So you're actually activating the core. I don't.
You know what we can do is we actually, like, once Jacob kind of can get the name of that chair, what it's called, and we can actually send it out to you guys, because he showed me this chair and it actually is really cool. It helps you to have this better posture, and he did a lot of research on it and found some good evidence-based practice to show the effects of it. The other thing that he also talks about is kind of a pad in your car to support your back, especially if you have kind of that position of that anterior tilt where you have that space and you have a lot of back.
Yeah, right? So any kind of good lumbar support. I drive with a cushion, a pad in my car to help decrease what we call Piriformis Syndrome, where the piriformis muscle tightens up from sitting. If you're driving for 1 to 2 hours in this flex position for a long time, those muscles get really tight. So I use just a regular cushion if I'm driving for long trips, and to make sure that, you want to make sure the seat is sitting up, and good lumbar support. You don't want to be slouched down riding like this. But the chair, the ergonomical chair, what I read from it, it has really good reviews, and it's a chair that actually supports. Good shoes, make sure that they bend at the toe, they don't collapse over. Make sure that you have a good supporting chair. And a lot of times what most people don't realize, when they're sitting on the desk, you want everything to be in alignment. So you don't want to be sitting at your desk right here, because you're activating these small muscles in the traps, and then you'll get what we call an overuse injury. Small overuse repetitive motion, and then you start having some upper trap pain, and then it can just, like I said, lead down the spine. So a good chair, you want a good posture. I really like the chairs that you can sit and kneel into. So you're actually almost kind of in this position, and your shins are on the chair pad, and then make sure that your arms are resting at a good position and you're not up here working the mouse. So choose good support and chair that keeps your body in a good alignment.
Yeah, and just to add on that, a simple fix you can make, kind of what Jacob was talking about. If I have Jacob kind of pretend that, say that he was facing this window, and he was in a chair. This is really important, this relaxed position, because what Jacob talked about, if he's stressing to reach through his chair, he's activating all these muscles that aren't really supposed to be doing that, right? And so all these muscles now become overused because of that position. The other thing I would recommend is most of us do not have the computer at a height of our eyes. And I would recommend figuring out how you can do that, whether it's raising the computer or whether it's kind of like what Jacob's talking about, having a different chair. Because especially for me when I study, and Jacob can tell you when he studied, right, we were always in this position. Like you're sitting and the desk is over you and you're looking down here. And that's how most setups are, even in a work office. But if you can elevate that, even just to elevate that computer, look at the difference. If he's looking here, you can have the mouse close to where you can have in this position, and this is where you would want to be.
Computer screen alignment here.
Yep, because when the computer screen is in line with your eyes, then you're not doing this, where he's extending his spine and he's kind of leaning forward in this little posture. Yeah, and if he put his chin up here like that.
So
yes.
I read a research in the head, we'll say average weight 8 pounds in alignment. As you go forward with gravity, you can increase it up to 20, 30 pounds. And that, we talk about the anterior neck pain. That when you're in this position, these neck muscles aren't activating at all.
Right.
They're just not activating.
And then that goes here, that goes here, and that goes here. So it's kind of like, it's crazy how it's all related. Like Jacob will tell you that, like, when we kind of work on his neck, it can make a difference in his low back. So it's like, we're doing a low back seminar today, but we're giving you kind of some input on other things we eventually will talk about and go through. Jacob and I's goal is actually to start doing seminars where we talk about from the whole chain of the body, starting with here, to help you guys learn the awareness we talked about. And actually, real quickly, I know that we're kind of like, we're already an hour, but the question that we saw about the pain after driving for an hour, the number one recommendation, I'm sure Jacob would also say this, is that external support. So when you have something like a cushion on your low back, And that's to help you avoid being in those bad positions for a long period of time.
And stop and stretch.
And stop and stretch. Yeah, it would be worth it if you're on a long drive and you're like, man, I'm actually gonna hurt, to stop at a gas station somewhere, do kind of a simple mobilization to open up your low back, to give it that release before just trying to keep going. Because that's when we keep trying to do that over and over and over again, that's when the body constricts. I believe that was a question, so please ask me to have more about that. The other one someone asked was about SI, which stands for sacroiliac. So that's the connection of that sacrum, the low part of your back, to your hip. Yeah, so she specifically talked, her question was about something called hypermobility, which just means where we're talking about when your tissues are tight, but hypermobility means that you have too much mobility. That means that like that hypermobility can be almost equalized to stability. And the reason I say that is because when things are hypermobile, so if these are the opposite, so we talked about them being stuck, but if they're like moving all over the place, they're not stable. And that makes sense, right? Like hypermobility, if they have too much mobility, you think they're probably dancers, like maybe gymnasts if you're younger, or a lot of times when we just have a lot of good mobility, but like if we're not focusing on the stability part of yoga, the strength part of it, then that's when things can actually have too much mobility and not enough strength. And so when we talk about SI hypermobility, we're back to everything we just talked about, which is stabilization. So that is the number one thing that I would say, that if you find yourself being like, man, I have a lot of mobility, but like it's unstable, meaning like when your spine, you try to move in different positions, you start to feel pain, but you're like, it doesn't make sense because my low back actually has a lot of mobility. Like I can go here, I can go there, right? But for some reason having pain, it's because we don't have stability in the front and the back to do that. So kind of what we're talking about as far as the hollow body holds, those are just a very couple, the diaphragmatic breathing, those are just a couple exercises to help you engage the muscles to get more stability. There's a lot more we can talk about when it comes to the relationship between your sacrum and your hip, but to keep it really simple, that's kind of, I saw that question, and so I kind of wanted to make sure I talked about hypermobility, not always, but is most commonly synonymous with instability. Okay, so you have to have stability and mobility. Both are very, very important. I think the last question was related to kind of the issue with scoliosis and having the increased of likelihood for back injury, right? And so Jake and I will tell you, obviously you have, your physician that can take care of you with that. But when it comes to just managing common low back pain, the exercises that we did today will be very, very beneficial. And when Jacob turns this around for us, so that you can see the front, these muscles that we use for the breathing help to keep this stable. So when you have an abnormal curve in your back that's not normal, which is what we call scoliosis, deviated in one direction or another, right? That already causes instability, right? So because like you think about, look how pretty these rivers are stacked up in a line, right? Like we would never build a skyscraper with like one building on the right, one building. Yeah, like we never built skyscrapers like that unless we're just trying to be cool, right? Like skyscrapers are always this beautiful single thing. And that's because they have the most stability that way. So when we have something like scoliosis that deviates our curves, we probably can't show it on here, but something like that, right? All of these now are in alignment, so they're not as stable, right? So the best thing I would recommend just for managing typical pain is to really work on getting these muscles really strong, stabilizing, okay, and to keep the mobility of your spine. Because what happens is with scoliosis, we don't really want to move it, like it becomes more difficult to move your spine in different directions, right? So you want to keep that mobility. So those last two exercises we did, especially kind of learning how to open up and have the mobility of your spine, will be really helpful for managing that. Yeah, that would be helpful. So we can answer more questions. I think that those were all that I saw at first. Does anyone else have any more questions? Do you guys feel like it was good? You learned some things? Yeah?
Yes. Yeah.
Absolutely.
Good. So our goal is maybe come like January that we'd like to really spend start with the neck and really spend a good amount of time teaching a lot about the neck. Jacob sees a lot of neck pain. He's dealt with his own neck pain. I have neck pain. And there's a lot to talk about that as well. And our goal is to actually kind of move down as we go through seminars and kind of make it a progressive learning process for you guys to become super in tune with your bodies. So
Awesome.
we really had fun.
Yeah,
Glad we
thank
got
y'all
to
so
talk to you
much.
guys today.
Thank you guys.
Very much.
Are you sure?
We'll see. I'll get the Jacob will find where those chairs he was talking about,
Yeah.
and I'll send that to Christy so that we can kind of give you guys that information so that y'all can kind of maybe start to adopt that in your daily life to help with some of the pain that you might be having.
Thank you.
Thank you. Thank you.
Thank you guys for coming. We enjoyed it.
What'd you say, Lana? No other questions, guys?
No.
No? Okay. All right.
Y'all have a
All right.
wonderful day.
Y'all have a great day. Bye guys.
Thank